Well, hello everyone. Welcome again to another broadcast. My name is Mr. Porter. I would like to thank Mrs. Porter for allowing me to record today for you regarding a very important subject that we all need to talk about, when it concerns dealing with children or working inside of the childcare profession. And these particular broadcasts is not limited just to those professions. It can be whether you're a parent at home or whatever. This topic today can apply across the board, across many type of platforms. Today we're going to be talking about shaken baby syndrome. Now, for those who are not familiar with shaken baby syndrome, it is when a adult shakes a baby to the point to where that child suffers injury. And many times it's serious injury that the child suffers. And we're going to get into that as we move along in this particular broadcast about the different type of injuries that can occur with shaken baby syndrome. Now, as daycare providers, you got into the business, you got into the industry because of your love for children, right? Okay. Yes, because of your love for children. At least that is, should be the foundation. Now, whenever you made that decision to get into the industry of the child care profession, there's a lot that comes along with it. Many times, stress is one of the big issues that come along with opening up a business and having to, get things established. And when you get it established, now it's time to watch those precious little ones. And a lot of times when you're watching children, your patience can be tested. So we're going to go over some tips today, as well as get into some discussion or teaching about what you should do when you have a child that cries nonstop. How do you handle that situation as a profession? Because that child, despite the emotional reaction and responses that they're going through, you as a profession, as a professional, need to know how to handle that child. So in other words, to keep your composure to not injure that child. Because one of the main things, of course, when you got into your business profession as a child care professional, you did not get into it to go to prison. And we're going to share some tips to keep you out of jail because you hear reports all over across the country of shaken baby syndrome, whether it's from parents at home or child care providers or, whatnot. You need to understand the importance of how to maintain your control, your composure, your don't lose focus of what your main intention was when it concerns childcare, and that is to protect those babies at all costs. Now, shaken baby syndrome can be considered, you may hear terms like shaken trauma syndrome. You may hear many terms of that may describe that, but the main point here is shaking a baby to the point, as I emphasized, to the point of injury, of causing trauma. And a lot of times the trauma occurs in the brain. Now, I'm going to read some things here to you regarding shaken baby syndrome. It is head trauma, and it is a form of abuse, and that is very serious. It is a form of abuse, and it has very serious consequences. I'm going to read here. How do these particular injuries happen? Well, it's when a person lose their control and they get the baby and they start to shake the baby. They shake the baby. They shake it, shake it, shake it. In other words, shut up, shut up, shut up, shut up, shut up. I can't take it anymore. I can't take it anymore. And within that violent voting convulsion of a movement, the baby suffers a very serious brain trauma that requires medical attention, and a lot of those precious little ones don't even survive, and that's why there's a very stiff consequence to individuals that are found guilty of child abuse in that manner. It doesn't have to get to the extreme to where the child loses their life, but any form of shaking a baby is very, very serious. And it says these injuries happen when someone, most often a parent or caregiver, vigorously or violently shakes a child to the point, the child can be shaken or thrown up against a hard surface, or this it's bad to even think about, even to voice that out to you of what things that can happen to babies that way. But we have to remain focused. You have to remain focused as a child care provider to remember, I'm going to emphasize it again, protect the babies at all costs. Now, what can happen to a baby with head trauma? We touched on this at the beginning of this particular broadcast. And here are some of the things that can happen to a child that becomes a victim of shaken baby syndrome. It's that children who survive may have partial or total blindness. It can affect the vision of the child. Here at the Knee-High Connections, we like educating, young minds towards achieving bright futures with education, and also helping businesses to prosper by giving resources and things of that nature to help businesses prosper. And as you notice behind me here, one of the five senses, this sense of vision becomes affected in an affected child of shaken baby syndrome, that they can have vision loss, and not only vision loss, but it can get to a point to where the vision loss can be described as blindness. So that's a serious effect that can happen to the child. Another thing that can happen to a baby with head trauma is that the baby can suffer hearing loss. That's another one of the senses. And as an educator, if you are teaching children the five senses, you want to teach them in a loving way to where, there's something that's needed in life. You need your vision, people. You need hearing. And a child that, suffers from this particular head trauma can also have hearing loss. Seizures, electrical activity out of control that happens in the brain, the way the child can have seizures. That's another effect. Developmental delays. That means they're not learning according to the level of age or standards that that the school system places that child. They're not up to the level of that point. They can be delayed. I mean, they can be 3, 4, 5 years old, and yet they're still, still learning the ABCs and 1, 2, 3s, and and so forth and so on. And I do recommend and suggest to you to do your study, do your research, find out what these particular important topics that we bring to your attention are about. Knowledge is key, and if you don't read, you cannot lead. And I recommend you read these resources and educate yourself on these things. Another effect of shaken baby syndrome is impaired intellect. That can affect the child. Speech impediments, that can happen with shaken baby syndrome, to where the child has learning difficulties. So that is another area that can happen. Whenever you're teaching a child, you want to have patience. You want to make sure and be sure that the child is learning at the highest potential to where they can become high achievers in school. You want to have that patience level, that degree of patience to teach the child and not, get aggressive and so forth and so on, because they're learning, In order to learn something, you first have to be taught. And that child is relying on you to teach them effectively the things that they need to know so they can excel and pass class as they continue to move up that educational ladder. So, you know, these particular things, learning difficulties, is another effect of shaken baby syndrome. Last few points here, it says problems with memory and attention. All this culminates together from the beginning of partial to total blindness all the way to problems with memory, memorizing things and paying attention in class to instruction. That can be a challenge to these children. Severe mental retardation that can happen to a child or baby that suffers shaken baby syndrome, and cerebral palsy, paralyzation of portions or parts of the body, whether it's the arm or the leg, or something is affected because there's a miscommunication between the spinal cord and the brain and that part of the body that was affected when the child was shaken. It can have lasting impact and effects in that child's life. So, this particular topic here is vitally important. These particular shaken baby syndrome can have signs and symptoms, and all these different type of traumatic things that can occur. And I'm going to quickly read to you because I don't want to draw this particular broadcast out, but I want to read to you some signs and symptoms of head trauma. Lethargy, meaning feeling tired and sleepy and sluggish. Irritability, that's self-explanatory. Vomiting, poor sucking or swallowing that the child is experiencing. That the parent or the caregiver may see or observe with their eyes. Decreased appetite, lack of smiling or vocalizing. Rigidity, meaning stiff, you're not, they're not loose and, just rigid. Seizures, difficulty breathing, blue color due to lack of oxygen. The body's not being oxygenated like how it should be because there is something, an impairment that has happened. Altered consciousness, unequal pupil in the eyes, in unequal pupil size, that is, and inability to lift the head, and an inability to focus the eyes or track movement. The finger can be moving along, and yet the child's eyes is not able to track that finger in the direction that the person or the tester is examining that child. The child vision is not there, and when the finger goes past, the child has a delay of trying to track. That's what it means by tracking, not being able to track with the eye movement. So this particular broadcast can go on and on and on. That's why I encourage you to do your research about shaken baby syndrome and learn that the tip is, if you haven't heard anything else, be patient. Work with the children. If you need to step away, step away. Don't do anything to hurt that child. If you have another person around and, they can assist, they assist. And one thing about childcare, don't try to be the butcher, the baker, and the candlestick maker. That you get burnout. You're burning the candle at both ends and you're burning it in the middle. You're going to burn out. And a lot of times that's what happens when a person shakes a baby. We're speaking of childcare, which you should not do this, but it can get to a point, as I emphasize, it should not, to where the person loses control and causes that baby injury by shaking them violently. Parents, they can learn from this particular topic as well, and to seek counsels. I'm not telling you what to do, but as a suggestion, seek medical professional help when it gets to a point to where you feel as though you're going to harm a child. And I know, we talk about education here, but this is a subject that needs to be discussed and talked about. Well, that concludes this particular broadcast. And again, thank you for tuning in. And hopefully you learned something. And, thanks again to Mrs. Porter for allowing me to share this information with you as you continue to prosper and succeed in business. All right, till next time. Bye-bye.